Hello viewers, I am Dr. Shailesh, a senior consultant at Shekar Eye Hospital. Today I would like to speak on a very important topic, that is COVID and eye. See, COVID is nothing but SARS, severe acute respiratory syndrome virus, which we all know, which has devastated the whole world financially, health-wise, and mentally. And we have reached already almost 2 years after the corona. Still, we are facing a lot of challenges in terms of its sequelae or is affecting the other organs. Eye being one of the important organ which also gets involved in corona. So, I would like to touch upon the disease corona affecting the eyes. So whenever the COVID happens, it is not only the respiratory tract or the respiratory infection. Along with that, it involves many organs also, and eye being one of them. So in eye part, I would like to describe the corona affecting the cornea, the overall orbit, the retina, and the nerve. So it involves all these structures. So in cornea or in the conjunctiva, the front portion of the eye, COVID affects in terms of the patient will have redness, watering, pain, sensitivity to light. So this is all part of the anterior segment involvement of corona. So there will be conjunctivitis and swelling and ballooning of conjunctiva. Movement will be slightly painful. So that is one part. Second part is it can cause other reactions inside the eye, that is called uveitis, where there will be cells and flare all will be there, and the patient cannot open his eyes to the sunlight, and it will be movement will be very painful. So that is one thing. And there is flare up of his autoimmune disease. Those who have arthritis and other joint pains, they get flared up as because corona also is a part of autoimmune disease. Now the other point is that corona also involves the posterior segment, that is the back portion of the eye, that is called retina. So here a lot of structures are there, the arteries and veins, they all get involved. One term is called as CRV or vein occlusion, where the vision slowly drops down, and another type of involvement is CRAO, where the artery itself gets blocked and there will be sudden loss of vision. And the other point is that there will be hemorrhages, there will be bleeding, and then there will be reactions inside the eye. So all these things lead on to the decrease in vision and inability to see the images very clearly. So that is one thing about the posterior segment involvement of the corona. The other point is that the last segment that gets involved is the optic nerve, that is the back portion of the eye. Here what happens is that the involvement of the nerve causes papilledema or swelling of the nerve, then there will be optic neuritis, and the other point is that the eye overall movement, the muscles are there around the eyes, the movement of the muscles are also get affected. Here the patient will feel doubling of vision or diplopia, what we call in say 2 to 2 images, because the movement of the eyes is impaired. The eyes will not move synchronously. So that is what is called the sixth nerve paralysis or the third nerve paralysis. The different cranial nerves which are there, which are involved in the movement of the eyeball, which gets affected in corona, and those will lead on to doubling of images. So patient will immediately come get to know because their vision is impaired, as well as the quality of vision in terms of they will trip and they will fall down because they see double image, they can't cross the road and all. So immediately they have to come and report to the eye doctor and then get it treated. The other point is that the overall eyeball also gets involved. That's called swelling of the eyes or retrobulbar neuritis. Then there will be glands get involved, the tear ducts gets involved, dacrocystitis or orbital cellulitis, the whole eyeball gets involved, they get frozen. The other point a lot of people are aware of nowadays is the mucormycosis, the black fungi. So these are like hidden fungus infection of the sinus which can come to the eye also. So they also have certain features like a movement restrictions, swelling, pain, painful movements. So we all should be aware of any eye symptoms whenever the patient is having corona should be thought of carefully and should not be neglected and should be shown. Now the other thing is how does this corona affect the eye? See, there are different ways, routes with which corona affects. See, normally by the aerosols or the respiratory aerosols that will directly come and touch, be in contact with the eyes. Number one. Number two, there will be throat infection and there is a tract from the throat to the eyes. So they also can get affected to the eyes. The third one is that contact with physical contact with your hands are in touch with the virus and then you will be touching your eyes. So these are 3-4 ways how the eye can get infected. That's why we will have to have preventive steps before I let it go for the treatment. I would like to address the preventive steps. See, always wear a protective glass or goggles while having corona or something like that. Number two, keep your hands clean. so that the virus will not stay in your hands. Number three, don't touch your eyes. If at all accidentally if you touch, see that your hands are clean. So hand sanitization, physical barrier in terms of glasses, and frequent washing of your hands. Now, these are three things which will prevent from eye getting involved. Then, whenever there is any respiratory involvement, so we have to be in touch with your physician so that it get it checked, so that it won't spread to the eyes also. These are the two things. Now, how do you treat these conditions in eye? So it's not very difficult because it's easily manageable. When you come in early stage, we have conjunctivitis, redness, we give antibiotic drops or lubricants because sometimes the our cornea nerves gets affected. There will be a lot of pain and sensitivity will be there. So we have to give lubricants and we have to check the sensation, how far it has spread. Then we have to see if there is any posterior part of the eyes involved. Many times we may have to use steroids or any other medications. Now, in this context, I would like to tell not only eye gets involved when the virus is involved, but eye also gets involved when you are on treatment with corona. So people are being given steroids or HCQs during that as a part of treatment. So these HCQs or hydroxychloroquine or steroids or the immunoglobulin sometimes can cause eye conditions or diseases in the eye and cause impair the vision. Although it is bit rare, but we should be aware that if any vision problem happening during the treatment of corona, one should visit eye doctor and we will assess and see if there is any condition which is because of treatment or because of corona itself. Accordingly, we have to manage. And these are the few steps that we have to follow during corona. So see that your eyes are protected. Any symptoms regarding vision, please report to the doctor immediately. And anything that is related to the respiratory symptoms, don't neglect because it can move to the eyes also. So in early stage, if you show, get it treated and prevent yourself from further spreading to the eyes by blocking your eyes with a physical barrier of glasses, hand sanitization, and not to touch your eyes. All these things helps to prevent the corona spreading to the eyes and further sequelae. So there is no life threatening as far as eye is concerned, or there is no sight threatening if you treat early. Only in rare cases, if the nerves or the arteries gets affected and if it is not treated, then you might tend to lose the vision. But overall, this is very rare. If you treat early, things can be settled early and then you can restore your vision. Thank you.